Welcome to our health and wellbeing surgery, the place to come for all your health and wellbeing questions, challenges, or just a bit of moral support in your case studies. So, how's everybody traveling? Just open up your mic and if you've got questions. Oh, and before we start, a big shout out to Alison, who's been hit by a flu bug. Certainly here in the UK, we're having what's been referred to as a flu wave, apparently. So get well soon, Alison. We're all thinking of you here. Any questions, any challenges, anything anybody wants to ask or check out? If not, it's going to be a quick class. No, you're traveling well, Norma.
Yeah, I mean, yeah. Yeah, it's interesting. I've the health and well-being, it just I like it. I mean, do you know what I mean? It's not, I don't know. It just seems to, I think, to be fair, I think that what I learned in the first module with behavior is, so you've got that and this other bit, and there is more, I suppose, with the health and well-being, there is more of the being able to do that sharing and caring. So there's more of that then than there was with the behavior modules, if you see what I mean. So yeah.
So that sounds like that's your kind of vibe as an animal communicator.
Um I maybe I don't know yet, because I mean I definitely feel things, and I hear things and I see things. But yeah, that yes, I think that and I know that, I think that the main thing is, I know that it's not my ache or my pain. That's and that's quite, it's quite reassuring to
Yeah.
know that. So yeah, so I've been enjoying the I
Oh,
mean, I've been
good.
enjoying all of it, but it just sort of, I suppose, feels a bit more comfortable, maybe.
Yeah,
That's
yeah, and that's okay. That's okay. We all have our different strengths, animal communicators anyway,
mm,
and then we often can have our favorite areas of work depending on what our strengths are and what they most apply themselves to. So,
mm,
and I think as well, not even halfway through the process. So for all of you, you're still kind of working out who you are as an animal communicator at this stage.
yeah,
And you
yeah.
definitely do not need to know like what kind of animal communicator you're going to be or what area you're going to specialize in, if at all. You
Mm,
don't need to know any of that just yet. So this is just about experimenting, and I'm loving that you're really enjoying this category,
mm,
and you're really liking that sharing and caring, and maybe that's where you lean into more as an animal communicator, and maybe by the time we get to the end there might be ways that you can see how you could bring some of that into your behavior work that you weren't able to do right at the beginning when you hadn't
mm,
really established your full toolkit.
yeah,
Historically used to leave behavior till near the end because it can be a bit more complex. But
mm,
the last intake, we started with health. We would normally always start with health, but the last intake started with health, and every single student, without fail, every single student had their first health case study that had a behavior problem in it. I've never seen that before. Every single student,
yeah,
everyone had their first health case study had a behavior element to it. And I just
yeah,
thought, they're not equipped yet with the behavior. So let's start with behavior next time. But it does also mean that you haven't found your flow yet as an
mm,
animal communicator. So I think it'll be interesting towards the end of the program
mm.
how you feel about behavior. And I know that you haven't said you don't like behavior, you've just said you're liking this category.
Yeah,
But
yeah,
once you've really got that full toolkit of approaches and techniques kind of built, it'll be interesting how that feels at the end. But oh, I love that. I love that. You're finding what you really like
Mm.
for the moment, and it might change and
Yeah.
it might not, and both are good.
Yeah.
Great stuff. Oh, I love it. So it's just open floor if anybody has any questions or challenges or anything you want to check out with me around the health and well-being. And if you don't, it'll be a short class.
I just wanted to say that Norma did such a wonderful job with my little Zoe. And I wanted to say that she picked up on some things that both Diana and Allison also picked up on in the past.
Wow.
So that was really, and we had such an interesting moment. After, I think she was waiting for me to tell Guardian what Norma had said. She had this weird moment where she had this dream and she was like howling. And then she woke up and just stared. She was staring at us both. I was like, well, I guess this is the time to tell you now, Guardian. And she's just watching, looking at me while I'm telling her. It was just the
Oh,
cutest thing.
wow.
And yeah, so thank you, Norma and Diana. And
Oh,
The
it was
pleasure.
that's wonderful. How reaffirming for yourself, Norma, and Diana, and Alison, that you all got same stuff, and also for you, Shayla, and the Guardian, because that's three people. If they've three people have all said the same thing, then there really is no doubt there, and then that helps you prepare, make decisions for Zoe, which that's great. Well done. Well done.
yeah.
Well done.
There's also something interesting that what Allison brought up a few weeks ago, I think she was saying that it felt like clients were sort of challenging
Yeah.
instead of. I've been thinking about that because I've kind of felt the same way, definitely.
Mhm.
But ever since we spoke about that and she brought that up, I've been noticing it's definitely. I think I talked to you about this on my first health case or my first behavior case, but definitely noticing that I have my own judgments, pre designed judgments right away because I'm actually noticing that the guardians believe more than me. I believe, but they are treating it as if they're taking like the one guardian that was wanting me to identify somebody. And here I am thinking that she's like, what are you talking about? This doesn't make sense and that doesn't make sense. But she's trusting enough. So I just thought that was really interesting.
So
That
what
it
does it
seems
tell you?
yeah. Mm, yeah, probably that it's a self-doubting thing more than anything else. And that's my lens that I'm looking at it through. Whereas most others probably are not. And I'm projecting.
Yeah, yeah. And if we hook into your perfectionism piece,
Uh,
and I'm just wondering, um, is there a connection? And I don't know if there is there a connection between this mismatch of believing, like your client's strength of belief in your work compared to your strength of belief in your work? Is there a connection between that and your old story of perfectionism, that you need to get it right, be perfect, and because you don't think, or you might not think in that moment that you are, that brings your belief down?
yeah, because I think definitely because it's all about, it sounds like, am I going to do a good enough job that they're going to believe that I'm actually doing it? And that's running. Meanwhile, they're like, well, I hope she can identify because I have a list of people. Like, whoa, 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 whoa. So, yeah, I think so.
And so
Definitely.
then that creates pressure as well.
Yeah, yeah.
That creates pressure, and then that can trigger that part of you. It's like, oh, I'm just trying to convince myself that I'm good enough to do this. Now they've got all this expectation and pressure because they want me to identify blah 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 blah, and I don't know if I can do that.
Mm, yeah,
Mm,
that makes sense.
that's an interesting one. That's an interesting one. I know that certainly for myself over the years, I've definitely had situations where when a client said something to me, especially if it's a client referred by another client, where they said something to me and I thought, oh, big gulp swallow. Am I able to live up to that reputation that the other client has just put out there for me? I've definitely had that, like, for sure. Or with past clients, you know, when you've done a really great job and then it's like, can I do that again? You know, so we can have that as well. So I don't know if that's in there too, but I do know that one. That's one that's familiar to me, certainly. It's like, oh my God, can I still live up to, you know, whatever the last, because, you know, there's that expression as well, you're only as good as your last job. So if your last one was great, you know, there's I think it's normal for that kind of logical left brain chatter voice, the monkey mind, to come in. But I just wondered if there was a connection there with the perfectionism, and that's why there was a mismatch in belief, because unless it's absolutely perfect, you're not going to put yourself there.
Yeah, that resonates.
Yeah. And here's the thing, spoiler alert, you're never going to be perfect.
Yeah.
And I don't mean that in any derogatory way, because actually we're all perfect as we are. But when you hold yourself to an ideal of perfectionism, we never get there. And that's what I mean. It's not because I don't think you'll ever be good enough at this, because that's not what I said. It's
I
when
get it.
you hold yourself to that ideal, you're never gonna get there. So this is where the good enough philosophy is really helpful. And that's been one that I've been working with for quite a few years now, especially in this business and with my programs and stuff. It's like, okay, is it good enough, Sarah Jane? Because if I was waiting for it to be perfect, it would never happen. And I've learned that the hard way. 2 years still sitting on something because it's not perfect. It's like, just, yeah, is it good enough? Is it good enough? And it nearly always is. Yeah. Yeah, an interesting one there, Sheila. I think there's a few kind of layers in there, isn't there? There's like some stacking pieces that are all around that. So just keep working on it, keep chipping away at it, keep doing what you're doing. You do this really well. You've got very, very good self-reflective skills. So just keep showing up with those reflective skills, keep doing the inner awareness, journal the hell out of it and see what comes up. That's where I would go with that.
Okay, thank you.
You're so welcome. Anybody else got any questions, challenges, ponderings, musings to do with health and well-being?
I did have this little, just, you may have touched on it in our call, but I wanted to make sure. So if there's two things, one big health issue, and then a emotion or red flag comes up, and Guardian has specifically asked for this one health issue to be checked out in their body, and I have to choose which way to go, I would be going towards what Guardian asks. Is that right?
Yeah, especially if they're paying you, because that's what they're going to play. Their expectation is for you to provide the service that they have paid you for. So I would always want to honour what the Guardians asked me to do. If the red flag was really big and I felt it really strongly and I just thought, I don't think I can ignore this, I would see if I could create time to do that as well. Now, I appreciate while you're just learning, that might be a tall order. But when you become more proficient, you could probably deal with both in the same consultation time. But I would address that if it felt really strong to me, and especially if it felt connected. And if it wasn't connected, if it felt connected, then it's easy because that's your inroad. She shared the emotion of blah, blah, blah. And I immediately felt that was connected to the health issue. If it's not connected, then the way that I would present that to the Guardian is very clear from the referral form that you wanted me to talk about X. However, as soon as I started the consultation, your companion kept drawing me to Y. And every time I tried to bring them back round to X, they kept pulling me over to Y. And because the way that I work as animal-led, I then opened up the discussion area around why, and this is what she came back to me with. And then I went back and looked at the health issue that you asked me to look at. Or if you ran out of time, if you ran out of time, it's a wee bit trickier, but if you ran out of time, you could say, I appreciate that this is not where your focus for the consultation was, but it absolutely was where the focus for your companion was. And I followed her lead. The other thing that you could do, if you had enough time, is you could email the Guardian, message them and say, look, this is the second time I've come in to work on issue X, and they're raising issue Y for me, and it's not health related. Where do you want me to focus the time? And then you're putting it back to them. That's another way to do it. But sometimes you're just in it and you don't have time to do that, and you just need to make that call. I would go with ideally what the client's paid you to do, but, and it is a big but, if the resonance around what the animal's bringing to you is really strong, I would want to cover that as well. So I would always try and do both if I could. And then if you can't do both and you've gone with the client's need, then you could say, this came up really strongly. They kept bringing me to issue Y and issue Z or Z. I only had enough time to go with issue X. So I would recommend that you book another consultation so we can explore issues Y and Z and then see what they say. Does that answer that for you?
Yes, very, very helpful. Thank you.
It is a tricky one. It is a tricky one. And sometimes clients don't want to hear anything other than what they're interested in. That happens, even when it's really important stuff. Depends where they're at, what they have capacity for as well. It's kind of like what Adele said in the accountability call. It's like, do I really want to hear that? Because once they hear it, they can't unhear it. And if they don't have capacity in their life at that moment, maybe their marriage or their relationships in a really difficult, rocky, precarious place, maybe work isn't going that great, maybe they've got children that have demands on their time that they did not expect, and another animal with demands on their time, and then we're coming in with, your animal friend wants to talk about this, and they're like, no, I can't cope with it anymore, don't want to hear it. Like, just dealing with their health situation right now is all I can handle. I don't want to hear that they've got this other thing going on. So it's that sensitivity that we always want to bring to our clients, and this has stood me in really good stead for many, many years, and it comes from my time when I worked in a drug and alcohol project. I worked there for many years, and I would see people's capacity, or more accurately, I would see people's lack of capacity to live a life. And so watching that, and watching people that were drug and alcohol dependent trying to have a life, live a life, deal with what they were feeling and experiencing, and just looking at how easy it was for people to make judgments and say, oh, they're a loser because, they're an alcoholic or they're drug dependent. And it's like, whoa, have you any idea what that person is dealing with and coping with? And they don't have capacity. They don't have capacity right now to give up drinking or give up drugs or give up whatever else. And to bring it into a slightly different light, we may not have dependencies on illegal substances like drugs. Alcohol's not an illegal substance, I know that, but we might not have dependency on alcohol to the point that we can't function. We might not have dependencies on drugs that are illegal and therefore make us criminals and be viewed by society in a particular way. But each and every one of us can have our own kind of dependencies that are perfectly legal and therefore socially acceptable, but there's still dependencies.
Coffee.
talked about caffeine last week. I had that same. Mine was on tea, not coffee, but I drank pots of tea at a sitting. I had a complete dependency on caffeine from tea. And I had withdrawal symptoms. Everybody thought I'd stopped smoking, and I didn't. And I was like, no, I don't even smoke. It was the tea. I was horrible. I was horrible. Like people at work, like, oh my God. But it was the withdrawal. I went cold turkey. They said I needed to give up chocolate or tea. That's what the hospital told me. And I was like, well, there's no fear I'm giving up chocolate. That's not even that. I can't even consider that. So I went down the tea route. Now, just to put a little bit of perspective here, when we were getting ready for work in the morning, so I was still living at home at that time, and my mum also liked tea, and so we would have there'd be like a big teapot, and then there would be holy war for the person that took the last of the tea out the teapot and didn't replenish it with more fresh boiling hot water. So that's like me and my mum. My sister didn't drink tea at that time, so we would finish a pot of tea between us, and then there would be holy war because somebody hadn't refilled the teapot. So then it would get refilled. Then I would go to work, and I would only have time for a couple of cups of tea in my morning break. I would have the equivalent easily of another pot of tea in my lunch break, and then in my afternoon break, and then I would be home. God knows how much tea I drank at night time. I drank a lot of tea. A lot of tea. And so when it was chocolate, this was to support my hormonal imbalance. Chocolates to go, teas to go. Like, I'm not even considering the chocolate. But I probably drank more tea than I ate chocolate, but the tea was what went. But I had headaches, sweat, grumpy moods, like the whole shebang from tea. Everybody thinks that coffee is where you get your caffeine from. No, you get it from tea as well, believe me. So bringing this back to what we were saying about capacity for our clients, they don't want to hear. We don't ever know what's going on in their lives. And so that time in the Drug and Alcohol Project, that really, because I was a trainer there. So I remember doing a training course where I decided to take this exercise and really flip it to help people that would judge drug and alcohol users, help see it from a different angle. And one of the exercises that I used to use was, I would ask people, have you ever gone on a night out and left their children in the care of a babysitter? Well, first of all, I would ask them, what do they think about parents of young children being drug users? Oh, that's ridiculous. Children should be taken off them. No, that's not responsible parenting. I'm sure you can imagine. And then I would do some other stuff. And then I would bring them to an exercise later on, which would be, how many times have you in your life as a parent gone out for a night out, Christmas night out, works night out, somebody's birthday, got a babysitter for the children, and then let the babysitter go home when you returned home? They're like, yeah, loads of times. Like, well, how many times roughly? So people start to number it up, and then it's like, well, that is no different. You're now in charge of your children, inebriated from a night out on the tile. I was like, I've done that. But it's about looking at capacity and judgment. And it's so easy to judge when we're sitting in our little ivory towers, and especially when we're hearing from the animals what they want and need, because in that moment, we are their voice, we are their advocate, and we want for them to have everything that they want, need, and desire. And so when we go back to the Guardian with that, and they're not able and they don't have capacity, it's easy to judge. It's easy to judge that they're not doing enough for their animals. Like, why would you not just put this in place? Why would they not just do that? And if you're not prepared to do that, you shouldn't have animals in the first place. We can really go to those places because we're there really advocating for the animal and feeling it all as the animal. But what I invite you to do is, think of that example there where we've all had times where we might have made a judgment about somebody else, but forgotten that we've done something fairly similar ourselves. And it's just because in that moment, we didn't think about it from that perspective, or we didn't have capacity in that moment. And so I always just think our guardians are doing their best. They're doing their best. And I appreciate there is a difference between people that you may come across in your case studies compared to people that you will have as clients. But know this, there's nobody going to part with their hard-earned cash to hear what their animal has to say that doesn't care. So if they're not doing what the animal wants them to do, needs them to do, is begging them to do, we have to remember this conversation. Think drug and alcohol users. They're doing their best with the limited capacity, resources that they have, and support that they have. So we need to be putting ourselves in that same place for our clients always. It's like, what is making this difficult for them to do right now? And then become curious about them in the same way that we're curious about the animal when we do the consultation with the animal. And it might be that the dog needs an extra 2 walks a day. I've been there with clients that I've really had to check myself, where their dog is shut in a garage all day long when they're at work and gets 1 walk a day. Why would you have a dog? You're, do you know, like, I really have to watch that, because that's my prejudice. That's my prejudice. But when you get curious about the client and you find out more what's going on, and when they feel heard rather than judged, then you can start to explore options. And one of my most favorite ones is there a kid on the street that wants a dog and isn't allowed one, that could walk your dog for you? Like, that's a win-win right there. Provided the dog isn't aggressive and likes children. You know what I mean, though. Is there a child, or if it's your horse, is there a child that would love a horse, love a dog, not allowed one, that could help you ride out your horse, could help you muck out the horse, could walk your dog every day after school? So yeah, we get curious about our clients the same way we get curious about the animals we communicate with, so we can understand them better. And then we're using the same processes that we use in the behavior work. What's the need here? Why is the dog not getting walked? And most of the time, in my experience, there's either some kind of underlying health thing, but that's not usually the issue, even if it might be the presenting issue. Usually it's a lack of support for that person at home. That's usually what it is, that there's a lack of support. Either the rest of the family don't muck in, or everything's left to them, or they're exhausted because they're doing X, Y, and Z, and there's just nothing left by the time they get home. So yeah, anyway, I feel like I've gone off somewhere with that one. I think that came from clients, didn't it? And clients that, are clients meeting you halfway. And you were saying, Shayla, that you've had that feeling of, as the intention. That wasn't your word, but from my memory from the last class as well, is that, what's a client's intention when they come to you? Is that where that came from?
Yeah, I think so. Yeah. Yep.
Because Alison had felt that the client's intentions weren't always pure. And you were recognizing that you were seeing that as well. So the piece there is a difference between some of the clients that you'll have as case studies and those that you'll have as paying clients. And the piece to remember is, a paying client is never going to pay you money to have you communicate with their animal if they weren't interested, if they didn't want to know. They just wouldn't do it. So if they aren't meeting you halfway or meeting the animal halfway, you want to get curious about the person so you can understand them better, so you can understand what's in their way and then help them move it out of the way. And then with your clients here, as case studies, this is where your boundary setting is really, this is where you get to practice. This is your playground. You do not have to take every client that offers to be a case study. You can say no. You can tell them you're full, even if you aren't, and you're grappling around through that final case study. If it doesn't feel like a good match, don't do it. And you just clear up front. This is what I need from you. This is the condition of me doing this work. It's not a free consultation. It's an exchange of time and energy.
Mm.
It's an exchange of time and energy. And then on the back of that, I really do invite you all right now in this program, but also you might need to write this down because you're not likely to go back and listen to all these recordings. I also want you to remember this post this program, after this program, especially if you go into running your own business. If you are attracting a certain kind of case study that doesn't show up, that doesn't send the paperwork in time, that doesn't do what you've asked them to do, or post-program, you are attracting clients that are pushing your boundaries, asking for extra, go here, up here. What is your thinking? What are you attracting? Because you're attracting them in. You are attracting them in. So you need to change the way you think about your clients and the clients that you want to work with. You want to see them all a level 10 commitment. I am only prepared to work with clients that are level 10 commitment. How do I know this? And I've not only had that with clients, and not just animal communication clients. I have to be honest and say animal communication clients are generally in the main have been okay. I've had some, like I've described, where you think, really, you're doing what? But that's where we can really support the client too. But I've had all manner of clients in my coaching practice. I've had all manner of students on this program over the years. So they're where I get burned the most. So these are all opportunities for us to look at where our boundaries are, what we're putting out there, and getting much more clear on the type of client we want to work with. I saw a really big shift in the students on my program. Would it be 20? I think it was 2021. I think it was 2021. And or around that time. And I just remember thinking, I'm not having another round like that ever again. It's not happening. Not happening. Like and I had a coaching team then as well. So it wasn't just me, and I wasn't just imagining it. So we were all feeling it. We were all feeling it. And it was that place of, and it wasn't every single person. It was not every single person. It absolutely was not. But there was a definite feel. There was a definite feel, a definite vibe that I just did not want to have ever again. That feeling of it didn't matter how much you gave, it's never enough. It's never enough. And as I say, we all felt it. It wasn't just me. Even Louise. She's like, some of these are really quite demanding, aren't they? I was like, yeah, I'm exhausted. Because you always want to do your best, don't you? And I would always do my best by people. Always, that's part of how I'm wired. But for me, the opportunity there was to just get really clear on what kind of clients and students and people do I want to have. I want people to show up and do the work. And that's what I've had ever since, in the main, just maybe one or two blips. But they were also opportunities for me to tighten up other stuff. So that's the way that I would always look at that. What is, rather than, oh my God, this is a nightmare. It's like, right, what am I learning from this? What can I take from this? Anyway, I feel like I've talked a lot, so I'm going to zip. Anything else that anybody else wants to say? Because I could talk about that all day long. Any other questions? Yes, Adele.
Oh no. Regarding last week, the animal communication. Now, I picked up that the animal had cancer, and I kept on saying in my head, no, not every animal and not every root's got cancer. you know, forget that, and it kept on coming, and I could see it all around the body, but I dismissed that, you know, and I thought, well, there must be something, that there's something else going on here, and it kept on, and then I got when we said about the medication and that, and going on to the next stage, I then got my mum, and I got morphine, and how she was with morphine, and how other friends with cancer were near the end with morphine. So I was picking this up. I know you're not allowed to diagnose, so I just wouldn't say dismissed it, but
So what's your question, my lovely?
well, when you pick that up, because obviously when you then told us, yeah, doctor did have actually cancer, I was actually right, but I was telling myself, no, you know, you can't just, it can't be cancer. Not everyone's got cancer, and it can't just come just like that. But obviously I was right, thinking,
So,
you know, straight away with what came to me. But then I was questioning it, and then I picked up, you know, about the nerves through the body. You know, it was the cancer through the body. But
so what's interesting here is you got a word, a feeling, an impression, a knowing that there was cancer,
yeah,
and you dismissed it because I think you said not everybody can have cancer, and we're not allowed to say
yeah,
cancer. So
yeah,
you dismissed the information because it was the big C.
yes,
But what you
exactly.
want to do is you want to take the information, keep the information, and then find a way to share that back to the Guardian without mentioning the big C.
Right.
But
Yeah.
you just, it's like you threw the baby out with the bathwater.
Yeah. Yeah.
You threw
Yeah.
you threw the whole lot out. But what you want to do there is hold the symptoms, keep the symptoms, ask for questions about the symptoms. The more information you can get, the better. And the more information you have, the less need there is to actually mention cancer. And you're absolutely right. We don't ever want to diagnose or mention that. But what you could have said was something like, I was drawn to this particular part of the body, and it just felt like it wasn't working the way it's meant to. I mean, there's a really easy way to, you know, say something's broke, and whatever cancer does, it's going to break stuff, isn't it? So it's just one way, to say that. You know, I was drawn to this area of the body, and it just felt like it wasn't working properly. Now, somebody said last week, Sheila, was it you that said you felt that something was dying?
Yeah.
Yeah. So again, you would probably want to be careful with the words, but that would be another way. You know, I was drawn to this part of the body. It just felt like something was decaying or dying, or I don't know if I would use dying if I didn't know the client, but that it was like the extreme opposite of healthy. There you go. Did that not do it? It was the extreme opposite of healthy. You haven't said unhealthy, you haven't said dying, you haven't said decaying. You've just said it just felt like the extreme opposite of healthy. And then you leave it for your client to put. Now, in this case, the client already knows that the dog has cancer. So she's going to come in and say, absolutely, he was diagnosed with cancer. And at that point, you could say, actually, it felt like that part of the body was dying. And I just, you know, didn't want to risk, you know, being in a kind of diagnostic place. So I chose not to use those words, but that now makes sense to me, because that would be exactly how cancer would present. So that's how you can start to open the conversation up. What you did there, as I said before, you got the right information, you just chucked it all out, because we're not allowed to diagnose, and we're not allowed to, you know, to use the word cancer, but you want to retain what you've got, just change the way you share it.
Yeah.
So that's the
Yeah,
answer
because
to your question there.
yeah, because I saw the organs all shutting down.
That's right,
So
yeah.
because I did say that, and I can say that, but it was, you know, the cancer all through the body, because that's what happened to my mum. So I got the images of my mum. She got breast cancer, but that was all in the bones everywhere.
Yeah.
So
Yeah.
she came to me.
So what you could say there, and I remember with a client many years ago, it was her cat, and it was Candida, and that's something that I'm familiar with anyway in humans, but not in animals. It felt like it was through the whole body, and I didn't know how to explain that. And I just said to her, it just feels like this is permeating through the whole body, like it's systemic. And it was as soon as I said the word systemic, the client said, I believe that it's Candida, and it's like right through the body. So you could just say this, I'm drawn to this part of the body and it feels like it's not working properly. Now, I would not say all the organs are shutting down. That sounds like you're making an absolute diagnosis. You're telling them that the organs are all shutting down. So I wouldn't do that. But what you could say is something like, it was a really unusual feeling that I had. Like parts of the body aren't working properly. It's like they could even be shutting down. And then you're just leaving out, you've not said they are shutting down, but you've said it's an unusual feeling. I can't quite name it, but it feels like the part of the body isn't working the way that it should. And it's like it's kind of shut down or slowed down or something. Do you see how that's quite different from saying all the organs are shutting down? Kind of feels like it's slowing down. It's not working right. It's slowing down or shutting down or something. So you've got that pondering part of the brain going for your client, and you let them work the rest out. That's how I would have dealt with that part. And then with your mum and everybody, I wouldn't necessarily share that with your client, but I would be clocking that for you, Adele, because that's maybe your unique. That, do you know? I don't know why this is coming in. There's a part of you saying, "Shut up, Sarah Jane. Shut up. This is not helpful," but it's still here. So I'm just going to give it to you, okay? You never heard this from me, and not on this program. But maybe you're going to be the cancer communicator. Like seriously, who knows? Who knows? And so maybe
it's funny that you should say that. I have I've gone all shaky now.
Yeah,
I have
me too.
Picked up so many lumps with my friends' dogs and stuff, and they had it checked out, and it's been cancer.
So maybe this is your niche. I just need to be really careful that the way that I teach this work, I'm not advocating that you go out and call yourself a cancer communicator. But if that actually ends up being your strong suit, and your mum's there to help you, and did you say another relative? If these are the people that every time they come through that animal has cancer, when that's happened half a dozen times, you can't deny that. You cannot deny that. What the gift is being able to frame that for your client in a way that keeps you legally safe. So I would just be doing what I always share with you all, keep it factual. You're never ever going to say to somebody, I think your dog's got cancer because my mum's here, my granny's here, my auntie's here, and the three of them always show up when it's cancer. You're not going to say that. What you're going to say is, I had something really interesting happen in the consultation. My mum came through from the other side. So did my grandmother. So did my aunt. So did whoever else was there. And what I've learned and experienced over the years of doing this work is that when those three come over from the other side in a consultation, it nearly always, now I haven't worked out quite how to say this next bit, but it nearly always, all three of them, right, all three of them passed with different types of cancers, unless they were all the same. But you know, whatever your truth is, all three of them left this world due to different types of cancers. And so every time they come in, to my work, I always just recommend that you get your animals checked out. I'm not suggesting for a minute that there is cancer, but there might be something that needs to be picked up at this early stage before it becomes something bigger. That's at the moment, off the cuff, that's probably the best that I could do. But is everybody getting the gist there?
Yeah.
And that's very different from saying, oh, my mum came through, my great Aunt Bessie and my granny, they all died of cancer, you know, so your dog's definitely got cancer or they would not have shown up. You're not doing that. You're not doing that. You're just being very factual. In my past experience, I've had 3 occasions where they've all come through on each occasion, and I probably wouldn't necessarily say it's cancer either. I would probably say something like, on each occasion, the animal had a condition that was either terminal at that time or could be if it hadn't been caught quickly enough. That's how I would probably do that. I think that's my best, 5 to 6 on a Tuesday night after talking nearly all day. That's the best I can come up with. But I'm sure you get the gist there.
Yeah, yes, definitely. Thank you.
Did that answer that fully for you, Adele?
Yes, it did. Yeah.
So remember, don't throw everything out because you can't diagnose. Keep it in, just change the language.
Yeah.
Because you did have that spot on last week. Okay. Any other questions before we close? Okay, so go grab a toilet break, a cuppa, and I'll see you in 3 minutes. Same place for the hot seat. And Sheila, I did get your form. It says it came in at 10 to 4, but I looked at them last night and it wasn't. I don't know why it wasn't there. So apologies for confusion, but it is there now. So I'll see you in the hot seat in a few minutes. Okay, and you, Adele, as well. Take care, everyone. See you soon. Bye.